Do you ever think about how many times you visit the restroom to urinate each day? Most of us don't discuss this openly, but it's a routine part of daily life for everyone. On average, people tend to go around 6 to 7 times per day. However, for some, what should be a simple and normal activity becomes challenging and uncomfortable. One such condition that affects individuals assigned male at birth is benign prostatic hyperplasia. Hi, I'm Neal Rowe, a urologist at the Ottawa Hospital. Today I want to shed light on BPH, what it is, its symptoms, diagnostic methods, treatment options, and the surgical interventions that can help manage this condition effectively. So first, what is BPH? Benign prostatic hyperplasia, BPH, occurs when the prostate gland is enlarged. This can result in urinary problems that affect daily life and health. BPH usually occurs in men who are in their 60s, 70s, or 80s, a time in life when the prostate is known to grow larger. It occurs very seldom in men who are under 40 years of age. Understanding what are the symptoms of BPH and available treatments is essential for informed decision-making. Only half of men with BPH are symptomatic. Symptoms include a frequent need to urinate, including regular trips to the toilet during the night, needing to urinate so suddenly and strongly that you may not get to the bathroom in time. When urinating, it might be difficult to begin. There could be some straining to maintain a steady flow. It can also feel like it is difficult to empty the bladder completely. Sometimes, patients with BPH have times when they cannot urinate at all. It is comforting to know that BPH is not a cancer. Your doctor may need to complete some tests to confirm if you have BPH. This is why it's also important to know how is BPH diagnosed. Your doctor may ask you to answer a number of questions and fill out a questionnaire about your symptoms. Providing your physician with this information will help to assess the severity of symptoms and how much they're impacting your quality of life. The digital rectal exam, or DRE, will help determine if you have an enlarged prostate gland while also assessing for any firmness that may indicate possible cancer of the prostate. Finally, your healthcare provider may arrange for special tests to assess your urine flow and how well your bladder is emptying. Now you might be wondering, what are the different treatment options for BPH? Treatment is guided by 3 principles: the severity of symptoms, the degree of bother, and patient preference and values. Depending on these, the treatment options will vary from lifestyle modification, medication, or procedures and surgery. If your symptoms are mild, changing behavior or lifestyle will help manage the symptoms. Here are some behavior or lifestyle changes that might help BPH. If you're drinking a lot of liquids, try drinking less, especially before bedtime. Avoid caffeinated beverages and alcohol. If possible, avoid medications that make your symptoms worse, such as some cough and cold medications. Set up a regular schedule for urinating with the help of your doctor. Avoid constipation by eating a diet rich in fiber and giving priority water over other beverages. Medication therapy is another option commonly chosen by patients as a treatment. There are 2 main types of drugs that treat BPH and work in different ways: alpha blockers, which relax the prostate, and 5-alpha reductase inhibitors, which shrink the prostate. Sometimes, multiple medications may be taken at the same time. Your doctor might also recommend surgical therapy if BPH is causing constant urinary problems, if it is affecting your kidneys, if you have urinary tract infections or blood in your urine, if your medication is causing side effects or is ineffective. There are a variety of surgical procedures to treat BPH, which include transurethral resection of the prostate, as well as a number of minimally invasive treatments. Surgery may be indicated if your symptoms are very severe or if BPH is impacting your overall health. To sum up, BPH is a prevalent condition affecting men who are getting older. If BPH symptoms bother you, there are treatments available that can help. It is important to talk about options with your doctor before you decide which treatment might be best for you. Thank you for joining me on this exploration of BPH. Follow the Ottawa Hospital's YouTube channel for more health topic videos.